Hi everyone and welcome to ATP Live Monday. I am Gbemisola Boyede. It's been a while that we've had ATP Live, so it's good to be back. Thank you so much for those of you who are joining us today. Thank you, thank you. Please share the video, invite your friends and family to join us on ATP Live Monday. ATP Live Monday is a program where you can ask any questions related to the health of your children and get a pediatrician to give you an answer immediately. So for the next 1 hour, so feel free to share the video, please, and then please I'm also going to do the same, just making sure that everybody can see and can hear me. So thank you so much for joining. If you are watching on Instagram or Facebook page, YouTube channel, or Ask the Pediatrician Facebook group, you can just drop your questions directly under the video and I'll be able to see them and provide an answer. But if you are watching on any of the other groups like ATP Family, ATP Still a Mom, you have to click on the video so that you can get to where the page is and then um, you can post your questions. But if you don't have any questions, that's fine. You can just keep watching on the whichever platform you're watching on. All right. So thank you so much, everyone, for joining us. Welcome, welcome, welcome. All right. So I'm just trying to share the video. Okay. Yeah, I think I'm good now. All right. So please, if you're on Facebook, drop comments. Let me be sure you can see me and you can hear me. Let me be sure that there's no internet issues. So, and I will encourage our moderators to help me share the video. I think my internet is a little bit slow today. All right, so share the video, ask your questions in the comment section, and we'll be good to go. All right, I think I'm just going to make it. Okay. All right, I can see some people have started dropping the question. Just give me a couple of minutes to make sure we've shared the video in all our other platforms, and then we can get to start. All right, okay. Thank you so much, everyone, for joining, and I hope you've had a wonderful Monday so far. Mine has been very busy day. Okay, so I'll be sharing the videos, but I think I'm really struggling with my internet today. Okay, good evening, Oluchukwu Lucy. Thank you for letting me know that you can see me. All right. Okay, please, when you're asking question, please be very specific with the question. Start with the age of the child. Give relevant information. If you're asking whether your child is not gaining weight, it will be necessary to know the current weights of the child and the birth weight, things like that. So that will prevent us from doing lots of back and forth about the questions. So please try and help us so that we can make it faster. All right. So okay, so I'm just sharing to the groups and then we'll be ready to start. Thank you so much. You're welcome, everyone, as you're joining us. Welcome to ATP Live Monday. We didn't have ATP Live Monday last week because it was May Day. It was a public holiday. We celebrated all our workers. I want to say thank you to all our health professionals, all our pediatricians, all our moderators, all the people that are working. Thank you so much for all that you do. All right. Okay. Just one more minute. I'm almost done with the sharing. Then we're going to start. I just have a couple more groups to share it to, and then we can start. For those who are dropping your questions, I can see your question. Please be patient with me, and we're going to answer all of them. So let's be dropping the questions so that once we start, then we can just we'll just be rolling. Thank you. All right, just a few more minutes, then we'll get ready. So I apologize if I'm a little bit slow today. I think my internet is a little bit slow as well. Okay. Okay, the final one. All right, so we can start now. I managed to do the final pinning. Good, we can start. All right, let me start from the Instagram page. So yeah, let's just start from Instagram. I can see Facebook people are also sharing. Good. All right. So let me just welcome everybody. Thank you so much for joining us today. If you have any question about the health of your children, please drop it, and I will try my best to answer them in the next 1 hour. I'm going to keep the time today. Trust me. So Timmy, welcome. Say hello, ma'am. My baby has been bitten by mosquitoes. Do I need to give any medication? The answer is no. So if you mixed my last ATP hour, which was on malaria, I did what I call updates on malaria, because April 25th every year is what we call the World Malaria Day. So we celebrated World Malaria Day, and I did a broadcast on malaria. And one of the things I've emphasized in that broadcast is the fact that mosquito bites does not automatically translate to malaria. So you can have mosquito bites and not have malaria. So this approach of always treating a child who has malaria with who has mosquito bites with anti-malaria is wrong. So because it is not every mosquito that can even transmit malaria, it has to be the female anopheles mosquitoes, and it is not every bite that is malaria. The mosquito have to transmit the malaria parasites into the blood, and that is going to take another 9 to 14 days for it to even manifest. So you do not need to treat your child because she has mosquito bites. Okay, that is number one. And then she said she has the patches on her skin. So I hope you are very sure that what your child has is not another skin rash. You don't just assume it's mosquito bites. Okay, so if you are not sure, every skin rash is not from mosquito bites. So you may need to make sure you see the doctor so that they can examine the child's skin and all that. But if you are sure there are mosquito bites and your child does not have fever, does not have symptoms of malaria, you do not need to treat the child. If you want more information on all the updates we have on malaria, you can go to my podcast or even our YouTube channel or our Facebook page and watch that ATP hour on malaria updates. So you will get all those information. And luckily, we're going to be having malaria vaccines for the children below the age of 36 months. So hopefully, our children will be better protected against malaria. So I hope that's helpful. Okay, Temi. Okay, it's the same Temi. You're repeating your question. Don't you don't need to repeat your questions. I can see them. I was just waiting to make sure I have shared all the videos. So thank you so much. So for those on Instagram, please drop your questions. Drop your questions, and we'll answer them. I think that's the only question I have on Instagram. I'm going to jump to Facebook. Uh, One Facebook user is saying, "At what age does a child develop a kneecap?" I'm not sure I really understand what you meant by that. A child already has their knees from birth, so I don't know what is your concern. It's maybe next. Sometimes it's maybe good for you to give a background or a context on why you are asking a question, so that we know how to address it. Number one, I'm curious as to why are you interested in the kneecap of a child, and why do you think the child does not have a kneecap at the beginning? So you may want to clarify and provide more information on that. All right, the next question is from Oluchi. Thank you for joining us. Oluchuku, sorry. The next question is from another Facebook user from our Facebook group, obviously. Good evening, Ma. I noticed a little bump at the deep end of my son's tongue. A bump. He has white patches on the tongue and also had bad breath. He's 5 years old. All right, so let's take that one by one. This bump, I'm not really sure what the bump is or what is causing the bump. I hope you are not referring to those ridges that we all have on our tongue, what we call tongue papilla. But if you're sure there's a swelling, something really big and obvious, then you really need to see any of my colleagues in the hospital so that they can look at that bump for you. If your child has white patches on the tongue, you need to encourage them to brush the tongue. So when you're brushing it, says the last 1 minute or so should be to brush the tongue as well. So encourage the child, and for a 5-year-old, you may still need to support them or supervise them doing that. And there are many causes of bad breath. Okay, poor oral hygiene is one of them. It could also be any disease around the neck and the throat area, like a child who has adenoids, enlargement, or tonsillitis, or dental abscess. So many things can cause bad breath. So everything is not always because the child has not been brushing their teeth. So of course we start with that. Make sure they brush their teeth twice a day. Make sure you don't give them all these sugary products and all that. So you do that, but you may also need to see the dentist so that they can examine the child. If the dentists have ruled out that it is not from their side, then they may be able to signpost you to other causes of bad breath, so that we need to deal with that. So basically, you still need to see a dentist anyway, so that they can examine the child and then they can advise you further. All right, okay. If you are asking question on our Facebook and you have not given StreamYard the permission to show your name, so don't carry on the conversation as if I can see your name. I won't know who is who. So don't start something and then continue. No, you have to make sure that you put all your question in one comment. Okay. If you have put something and you want to update again, you need to start all over again and make sure you let me know the connection and the name of the person that was the one that asked about this sneaker. This is the update. So that way it makes sense. Then without seeing your name, I won't know which one of your question, because I can't see your name. So for this Facebook user, I'm not sure whether you're the one that asked about kneecap or whatever. But I don't understand your question. You need to ask your question as a full question. Starting with the age of your child and what your worry is. Don't also just you need to be able to say, this is what I really want you to tell me about this issue. Then I will know how to address that. All right. Okay, so if you are the one talking about asking if your child has white patches on the tongue, somebody is asking, good evening. My baby is 1 year, 1 month. Birth weight is 2.5. Current weight is 8.9. Is the weight okay? Yeah, the weight is not bad. An average 1-year-old should weigh 10 kilos, but your baby weighing almost kilos is still acceptable. Also, my baby was given MMR and chickenpox vaccine last week. She didn't have any fever. It is not compulsory for your baby to have fever after vaccine. I get all this question all the time. So something is a side effect does not mean everybody will have it. So some children have fever after immunization. It does not mean that those who did not have fever, the immunization is not working in them. No. So it is not all right. Sorry, apologies for the breaking transmission. All right, I think I've answered this question on Facebook. I was asking about MMR and chickenpox vaccines. It's not compulsory for your child to have fever. Yeah. So the fact that your child doesn't have fever does not mean the vaccine didn't work. So there's no need for you to worry at all. All right. Okay. So let's go on. I'll come back to Instagram. Let me just continue with Facebook for now. Somebody say, good evening. My baby of 4 months shake his hands and feet while asleep. So this is not unusual for babies sometimes to shake their hands when sleeping. So it's nothing to worry about. We worry about if your child is shaking or checking in their sleep to the point that it wakes them up, like they cry out of their sleep. That worries us, and they are struggling to go back to sleep because that may be a form of a conversion. And what I recommend in that case is that you do a video recording of that particular episode of the shaking, and then you can show your pediatrician, and they should be able to tell you whether okay, this is normal shaking or whether this is a convulsion, which is the only thing we worry about really. But if sometimes your baby just shake a little bit of their hands when they're sleeping, it's nothing to worry about. Okay. The next question. Somebody say, well done. My baby is born prematurely at 33 weeks. Age is 8 months old. Birth weight is 1.15. We are on asthenia, severe calcium, whatever. Slow care. Why is the baby on slow care? But his weight is not encouraging. So you should speak to your pediatrician. I want to believe that a pediatrician puts that baby on slow care, which is potassium supplements. And my question is, why is baby on potassium supplements? Why is the baby on that? So you really need to, because it's not something your baby should be taking forever. So if your pediatrician puts your baby on it, you must go back for follow-up. You should not just keep taking medication forever. If you have a preterm baby, your baby has to be under the care of a pediatrician for at least the first 2 years of their life. Okay, so this baby has to be followed by a pediatrician. Your baby was very small. If your baby was born at 33 weeks and was weighing 1.1, that baby was what we call small for gestational age, because your baby 33 weeks is almost close to 37 weeks, which is normal time. And so we expect a 33-weeker to be weighing at least 2 kilos. So if your baby is weighing 1.1, which is like the weight of a 28-weeker, so that means your baby already was small for gestational age. So the question is, why was your baby small for gestational age? So your pediatrician will know all that. That is number one. Why is your baby on slow care? That means there are other issues that your baby is dealing with. So your pediatrician will know all that as well. This is why you really need to be following up with your pediatrician. So your baby, the question is, what is your baby eating as well? You've not told us that. So at 8 months, I guess that 8 months is your baby's current age. I'm assuming your baby's corrected age is about maybe 6 months or so. If your baby was born at 33 weeks. So an average 6 months baby should be weighing close to 7.5 kilos and all that. So your baby's weight is really, really small. So this baby is having what we call failure to thrive. So this baby needs to see a pediatrician. It's not a matter of what food can I give. I don't know what you're doing already. I believe you're breastfeeding. I believe you're giving complementary feeding. You didn't tell us that. That's the most important information to also tell us, since you are going to ask us what food. So sometimes it's not just about food. So just the little information you've provided me about your baby, I have so many concerns about this baby. So this baby obviously was small for gestational age. I don't know why that is. Was the baby having any problem at birth that made the baby to be born too early? And even when born too early, was also too small for even the age when the baby was born? Or why is your baby on potassium? That is not something we give preterm routinely. So if your baby is not following up with a pediatrician, you really need to do it now. You really need to go to the hospital. This is not something I'm going to be able to resolve for you on Facebook, because there are so many other parts of your baby's history that I need to know. But meanwhile, in terms of food, keep breastfeeding, give complementary food. There's no food your baby cannot eat. If you need more information, you're on our Facebook group. You can go to the guide section, watch all the feeding videos and all that. But more importantly, your baby needs to be seen by a pediatrician urgently. We need to be sure there's no heart problem, there's no problem with any of the organs that could make baby to be failing to thrive. Baby could be eating all the food in the world and still not gain weight because of that failure to thrive. So that is why your baby needs to see a pediatrician. All right, I hope that is helpful. The next person, Juliet Sunday, say my baby of 4 months is on exclusive breastfeeding. I noticed she has been passing out green stools, and it comes out with these drooling parts that looks like a tear. She often poo anytime she finishes eating. Greenish stools usually suggest that your baby is not getting enough breast milk. So, and also make sure you are not giving any other food. When Nigerian mothers tell me they are doing exclusive breastfeeding, I always like to ask them, are you also giving water? Because many of you don't see giving water as not exclusively breastfeeding. But when we say exclusive breastfeeding, we mean breast milk only, no water, no drugs, nothing else. So if you are doing any of those things, you should stop, because when you give water, you are diluting the milk further. You are also exposing the baby to germs. So some of these water too are not, in quotes, pure. So we really need to be sure you are not doing any of those things. So a lot of people ask me about exclusive breastfeeding. I'm EB, exclusive breastfeeding, but they're also giving water. That is not exclusive breastfeeding. Or you are giving drugs that your doctor has not recommended. That is not exclusive breastfeeding. So make sure you're giving breast milk only. No water, nothing else. No drugs, nothing else. And make sure you breastfeed your baby on demand, and make sure you empty the breast. A lot of mothers also breastfeed the baby and they just quickly give a little bit and then they remove the breast. The beginning part of the breast milk is watery. We call it fore milk. And then the last part of the milk, is what we call hind milk, and that is the one that has a lot of fat that fills the baby up. So when you breastfeed, you must make sure you empty the breast, okay, and then you alternate the breast as well. So these are very important things to do, and if you are doing that, then your baby should be gaining weight, and your baby should not be having greenish stools. Sometimes greenish stool could also be from some of the things you're eating. Some of your there are some flavors of food or some coloring of food that can also pass through breast milk from the mother to the baby and can make the green, it is still greenish. So we're not so worried about that, but you really need to be sure it is not because your baby is not getting enough milk. Your baby's weight at 3 months is encouraging, so I'm not worried so much about your baby. So just keep breastfeeding exclusively and don't worry. There's nothing wrong with baby passing through after breastfeeding. It is what we call a gastrocolic reflex. So there's when baby is eating, there's some peristatic waves that moves things along. So it's also stimulate the rectum. That is where the stool is stored, and then babies tend to pass through. And even some adults do the same. There's nothing wrong with that. It is not this food they are eating now that they are passing. It's the one they've eaten that has been digested, that has been stored. It is just that gastrocolic reflex that makes it feel make them feel the urge to pass through, and there's absolutely nothing wrong with that. So I hope that's helpful. All right, I'll take one more question on Facebook, then we'll go back to Instagram. Somebody said, my boy of 4 years old always having catarrh, especially when taking his bath. All right, so your baby always having catarrh has nothing to do with taking his bath. Do you mean your baby sneeze when taking his bath? Because when have catarrh, in my own understanding, is your baby is always having runny nose. So that is the definition of catarrh, and that has nothing to do with when baby is having his bath. So it doesn't mean that the nose always run only when having a bath, and other time the baby doesn't have any runny nose. Then that is not catarrh. That is just maybe the water you're pouring on the face dripping down the nose. But if your baby is having runny nose after you've given a bath, then that is catarrh, and that has nothing to do with the bath. Okay, and if your baby is having runny nose all the time, you need to see a pediatrician or ENT doctors, because some children have what we call allergic rhinitis. They tend to have runny nose all the time, and the treatment is different. We need to know what are the triggers, how do we avoid it, and things like that. So your question is not really clear. So initially when people say my baby is always having, I always like to have context. Always doesn't mean anything. How many times in a year, how many times in a month, how many times in a week? Those are more relevant information than just saying always, because this child is 4 years. So is the child be having a catarrh every day of his life for the past 4 years, or is it just maybe once in a month or once every week, or that information is very important so that we know how to give you further information. All right, so let me go back to Instagram, people. Somebody said, when can I stop breastfeeding? When can I stop my baby breast? I'm not sure I got that question from Bailey Keller, but if you are asking when can you stop breastfeeding, Okay, we encourage you to breastfeed for as long as you want, and you can breastfeed up to 2 years and beyond. So there's no law about when you can stop breastfeeding, but we encourage you to do it for at least 2 years. Okay, some mothers will do at least 1 year, but the longer the better. And when you breastfeed long, you are not only protecting the baby or supporting the baby, you're also protecting yourself, because breastfeeding protects you against breast cancer, against ovarian cancer. So it's good to breastfeed for as long as you can. All right. So you say, when can I see my baby breast? She's 9 months old. No, your baby 9 months. Please keep breastfeeding. Okay, your 9 months is too young to stop breastfeeding. Your baby needs breastfeeding. Breast milk is beyond feeding your baby. Breastfeeding is about protecting your baby. You are passing antibodies, you are passing protective agents to your baby, so that baby does not start having infections and all that. So your baby is sucking too much, that is good. It's good for the baby to suck. But at 9 months, your baby should also be taking complementary feeds. But complementary feeds is food, but breast milk protects your baby beyond food. Okay, so that is why you should breastfeed. So come again in August. We will talk about our breastfeeding week. We will tell you more about why your baby should be breastfed for as long as possible. Okay, breastfeeding save a lot of children from deaths, from infections, from allergies, and of course, it also protects you as a mother from cancer and all that. So you should breastfeed your baby. It's best to breastfeed. Mimi Bank, say my daughter has cough, is ready to go. Mimi Bank, always start with the age of your child. How old is your child? And how long has the cough been going for? And all that. We need those contexts so that we can advise you appropriately. So Mrs. Simon at good evening. Can I give my 15-month-old baby apple juice? You can give apple juice, preferably the one you make yourself in your own kitchen. So you put your apple in your blender and you make the juice. That's good. We don't encourage you to be doing all this when you buy in the store. Most of them are just concentrates and sugar that have been mixed. Okay, so they just loading them with sugar and all that. So avoid all this unnecessary juice, and we don't want children to be hooked onto these things and then they don't eat the proper food. It's better your child eats apple rather than take apple juice, honestly. Or if you want to do, you can make a smoothie with the apple, or you can, of course, do your own juice in the kitchen by yourself. That's fine. So, but avoid the one from the store because they have high loads of sugar, which is not good for your child. All right, thank you, Instagram. So please drop your questions. I'll come back to Facebook now. Oh, my internet is stable now, thank God. All right, Juliet Sunday say my daughter of 2 years and 8 months always have catarrh and cough, especially when the school is in session. And I noticed inside her eyes, the whitish area is not that whitish, but has dirty brown. Okay, so I think your child has what we call atopy. Atopy is a kind of condition that children have allergies, and they have allergies in many organs of the body. So they have involving the eyes, they have allergic conjunctivitis, they have the nose, they have allergic rhinitis, they have on the skin, they have atopic dermatitis, they have in the chest, they can have asthma, and some children have all of them. So already your child has the eye one, also has the nose one. So that is allergy. So the most important thing is to know what are the triggers for your child. Some children is the dust, some children is the pollen, some children is the grasses and all that. So you may want to avoid anything that you know tend to trigger off your child's allergy. It's a little bit difficult when children are in school because they have to go to school. There's a lot of dust, there's a lot of grass, there's a lot of all those allergy stuff, and they are exposed to them. So in that case, you will still have to see your doctors. You can see the pediatricians. Sometimes we have to put those children on medication to kind of calm down the allergy. But the best option is to avoid them. But sometimes we can't, and we have to treat. So the eye doctors can give you something for the eyes. The ENT doctors can give you something for the nose as well. that is how it is. But if you know what are those things that tend to trigger it off and you avoid it, then that'll be better. And then also when children go to school, they are exposed to other children who are also having cough, catarrh, viruses, and so it's a vicious cycle for them to keep having all these cough, catarrh, and all that, especially during the school session. So we can't say the children should not go to school anyway. So we just have to manage the situation. If it's really bad, then please see my colleagues, see the pediatricians, and we can give you some medications to kind reduce it. We cannot cure it. It's not going to disappear. Allergies, how the child is, genetic. That's how the child responds to things. We cannot stop that, but we can give something to kind of make the reaction less aggressive. Let me put it that way. So I always like to give that, because a lot of parents are always looking for fix. You want us to fix everything. We can't fix everything. That is the honest truth. So some things we manage. Okay. So allergic condition is one of those things we manage. We cannot fix it. It's just like having asthma and all that. We talked about asthma last week. Yeah, exactly. Dr. Gbemisola Boyede did the asthma presentation, and she talked about the management. We can only manage it. We cannot cure it. We cannot fix everything. And things can get better, but they will always have that allergic tendencies, and that is just who they are. That's part of their life. Okay. All right. Somebody say I'm learning. Keep up the good work. Thank you. Somebody say, please, how do I treat Ela? So Yoruba use the word Ela a lot, and they use Ela for virtually all skin rashes in babies. Any little thing is Ela, Ela, Ela. So we don't like using native diagnosis because they lump so many things together. So I prefer you tell me, this is a rash my baby is having. This is where the rash is. This is how it looks. Maybe it's the color that is changed, or maybe it's something like liquid water or pus inside. Then I will know what kind of rash you're referring to, whether it's a bacterial infection, whether it is fungal infection, whether it's an allergy. Then I will tell you the treatment. But just saying Ela is not very specific enough. And if you're on our Facebook group, it's better you take a picture and post it. This is my so age-old baby. This is the rash. This is the rash has been going on for that long. The child has itching with the rash, or fever with the rash, or whatever other symptoms, and then we can give you advice. But just saying my child has this and you're not giving those contexts, it's not going to be helpful. Just like asking, how do we treat Ela? You have made that diagnosis. It may not be our own diagnosis, and so we cannot treat the diagnosis that we have not made. So it's better you take a picture, show us a picture, tell us the history. Then some of you like to put pictures and then you just expect a magical diagnosis. No way. It doesn't work that way. When you put a picture, you need to tell us information, because 2-3 things can look alike, when it comes to rashes, but the information you provide will help us to know which is which. For example, measles. A lot of mothers see rashes that look like measles, and they always think everything is measles, but there are many other conditions that will give the same measles-like kind of rashes. For example, your child may take ampiclos and will have rashes as if the child is having measles. It is not measles. That is a drug reaction to ampiclos. Okay. Sometimes some other conditions can also present exactly. So it is the information you give us that will help us to know that, this is drug reaction or this is measles. Okay. So if you tell me your child has been having fever, your child has been having cough, catarrh, red nose, and now has this rash, then I will know that is measles. But if your child does not have fever, your child has been well, maybe your child has ear infection, and your doctor gave you ampiclos, and after taking the ampiclos for 1 or 2 days, your child has this rash, then I will know this is a drug reaction. So just putting a picture and saying, what is this rash? How do I treat it? It's not helpful to any doctor. You have to give that context, because the two rashes can look the same, the cause are different, the management is different. For example, if your child is reacting to ampiclos, I just need to stop the ampiclos. I don't need to do anything else. But if your child is having measles, the treatment is going to be different. So that is why it is important to always have a context. All right. Okay. Somebody say I also want to know. I don't know what you want to know. You better you say what you want to know. Somebody say my baby of 6 months has been stooling. So again, stooling is not very specific. You need to tell us your baby passing watery stool or normal stool. Because a lot of people that will say my baby is stooling. What they meant is that the baby is passing stool 4 or 5 times a day. But the stools are normal stools. They are not watery. They are not hard. That is not stooling. That is normal. But maybe some others expect that baby should only stool once a day, and now the baby is passing stool 4 to 5 times a day. Then that means, oh, this baby is stooling. So we always like to have context. So your baby is passing stool that worries you. Tell us how many times in a day in a 24-hour period. What is the texture of the stool? Watery, hard, okay? And even the watery, specify. Is it like watery, like sinking into the diaper, or or just a little bit loose? Because a lot of mothers call it watery, but it's actually just loose stools and all that. So we need to have that information to be able to give you answer, so we will not give the wrong answer. Because I see a lot of mothers giving ORS, oral sync. I mean, when you probe further, that child does not have any diarrhea. That child does not need any ORS. That child does not need any oral sync. So it's very important that we have the context of your stooling. Like this Facebook user, please repost your question. It is not yet making meaning. So I guess you were going to ask again because it's not even complete. I can't remember who is person asking about color. So if you don't worry, if you left when I was answering your question, no need to panic. You can watch this video again. With the video will always be there, and the answer I gave, you can always watch it again. Sorry, unfortunately, we cannot always go back. So you can always watch the video and get your answer. Um Ifeanyi is asking, what is the right time for a baby to start walking? I guess you mean walking, that WALK rather than WORK, because I don't expect any child to walk before the age of 15 years. Okay, so I guess you're talking about walking, WALK, 1 year old. So most babies should walk by 1 year. However, if your child is not walking by 1 year, we are not worried until they're about 18 months. Okay, we give time for all of us are not dangote, so all of us are not going to the same thing for the children. So all the children are not going to work at 1 year. So we give some time for babies that are a little bit slower to catch up. So but usually by 18 months, we expect everybody to have caught up. Okay. So if a child is not working by 18 months, then we can say this child definitely there's something wrong, and that is when you have to see a pediatrician, and we want to figure out why is this child not working and what can we do about it. So I hope if I get your yeah, somebody saying so Capricorn is not okay. It's not okay. Oh, a lot of mothers give all these things to our children which are not okay, and you know it yourself that they are not okay. Okay, we actually have a guide section on our group for what is LD drinks. LD drinks for babies. I encourage you to go through that uh, um, guide section. Okay, so water, milk, natural fruits. Those are what is healthy for children. Most of all these things you buy in the shops, they are not healthy. Okay, most of them are concentrates, they had a lot of sugar, and they are just packing it for your children, so they are not okay. In fact, some of the schools, I remember some when I was my kids' school then, the proprietors will not allow you to pack any of those things into their lunch box. It's either you put in a fruits or you put water, nothing like all this caprizone, bobo, nothing. So it's not right, it's not healthy. These are the reason why some of our children are becoming obese, all these biscuits. So when you go through our guide session, most of you go through the guide session looking for how to feed your baby, what are the food you should give. But there's actually a video on what you should not give as well. And I don't think many people watch that one because maybe that's not what they're really interested in. But there's actually a video on what not to give to children and all these things, all this junk food They are all there. We should not give our children that. I know it's okay. We want to give our children treats and all that. Okay, once in a while they're doing birthday and they're doing all those things. Okay, you're just giving them a treat. Okay, but it should not be their everyday thing, which is what most mothers were doing. So all our children takes every day is all these juices and drinks. I see mothers even giving so-called Ribena to babies who are not yet even 6 months old. When they're supposed to give water, then they're, oh, my baby's not drinking water, because you're always giving it with Ribena. Then why would the baby want to drink the plain water that doesn't have any sweetness in it? So please, let's not start. And I see mothers asking us on ATP, can I give my baby biscuits? Can I give my baby what's the other one? I forgot it. They ask all this kind of like, okay, now the mothers are the ones trying to introduce the children to this junk food, and then later on you will come back and say, pediatrician, my baby is not taking normal food. My baby only wants to eat this, only wants to eat the biscuits and or bread and tea and all that. We started the whole thing. How is some of that? Babies don't know anything. It is only what we introduce to them that they know. So if you never give your child biscuits, the child will never know there's anything called biscuits in the world, honestly. So if we don't start our children on this junk food, they will never know they exist. If we start them on the healthy choices like our fruits, all those things, then those are the things the children will know. So we can do better choices. And it bothers me because it is not even the children asking for them. It is the mother asking, can I give my 6-month-old biscuits? Can I give my 7-month-old Ribena? Can I give my 7-month-old malts? And I'm like, seriously, what is the problem? Why are mothers so keen on starting children on these chunks? So we really, really need to put a stop to it. We need to put a stop. And I mean, of course, that's why we are all here today. So let's do better. All right, let's go back to Instagram. So Instagram people will not be upset with me. All right, where did I stop? Yeah, apple juice. Yeah, we've answered that one. So somebody, Mrs. C. Wiggle. My baby of 6 months has been stoning after every feed since yesterday. The pool sinks into the diaper. Okay, that sounds like watery. Took her to the hospital. She was given ORS and zinc tablet, but she's still stoning. That is not a problem. So I don't know. I get this question all the time as well. This ORS and the zinc is not to stop the stooling. I think mothers always misunderstand that. Most of you think we give you the ORS and the zinc and then the stool should stop. No, the ORS is meant to rehydrate the child. We are replacing what the child is losing. That is all we're doing. We're not trying to stop the stooling. The stooling will stop by itself. It's going to run its course. Most of them are due to viruses. They don't need any special treatment. They don't need antibiotics. They don't need nothing. They're going to run their course. Usually by 10 days, they will stop, okay? So what we are trying to do, the stooling or the stools are not the problem. They are not our concern. They are not going to kill the child. What will kill the child is dehydration, okay? It is a loss of the water. It is a loss of the electrolyte. Those are the things that will kill children with diarrhea. So what we want to do is to make sure that all the things the child is losing, we are replacing them so that the child does not get dehydrated, does not go into shock, does not have electrolytes derangement. So we are not trying to stop the stooling. And please do not stop the stooling. A lot of mothers will go and buy Diastop, tetracycline. What are the other ones? Please don't give your children those drugs. They are dangerous, okay? We don't want to stop the stooling. We want the stooling to go on and stop by itself, because all those stooling itself is carrying away the viruses. As they are shedding the virus, they are taking them away. When you force the virus or the bacteria or whatever is causing the stooling not to go out, they go into the blood, and then the child is going to now have what we call sepsis, something more serious, more sinister. All right, so don't worry about the stooling. Focus on rehydration. Focus on replacing what the child is losing. Why do we give the zinc? The zinc is to heal the intestinal lining and to prevent future episodes of diarrhea and pneumonia. So the zinc is not the stool stopper. Let me put it that way. The zinc is to heal. The zinc is a very good element, important for what we call the lining, the epithelium, the layer that covers the intestine, that covers the lungs and all that. So the zinc keeps them healthy. So that will protect the child from future diarrhea and future pneumonia. So that is all we're trying to do. We're not trying to stop this. So don't be in a hurry. Don't worry about the stooling. Just make sure you are replacing what the child has lost. That is number one. Number two, prevention. Why is the child even having diarrhea in the first place? Number one, exclusive breastfeeding for the first 6 months. I notice that when mothers start complementary feeding, we do some wrong practices that make our children to be prone to diarrhea. No bottle feeding of complementary foods. No bottle feeding. A lot of you are giving pap, Cerelac, all those things. You're giving them through bottles. No bottle feeding at all. Okay, even the milk, they should drink it from the cup. No bottle feeding, because there's no way you're going to be able to clean those bottles, and those bottles just grow those bacteria very fast. Okay, but if you feed with a cup and spoon, you wash it properly, you dry it. Okay, there's no hiding place for bacteria for them to germinate. Don't be giving leftover food. So make enough food for the child to eat and let them finish it. If they cannot finish it, please finish it. Don't go and keep it and warm it, even in bottle. Some people even keep it with a bottle. That is a culture full of germs that you are giving to your baby. Even though you've warmed it again, you are warming the bacteria to feed the child. These are the things that predispose children to diarrhea. The water, because usually from 6 months, that's when you start giving water. Please boil the water. I know it's pure water, but it's not. Most of them are not pure. So make sure you boil it, unless you are buying a good brand of bottled water, that you are sure is a good brand. Because there are some people that bottle water at their backyard. You all saw the videos online. People will just go and put well water and bottle it and sell it as bottled water. So to be on the safe side, you better boil your water, and then you will not have problem of diarrhea. So those are the things we need to do. Of course, make sure your child take rotavirus vaccine. Rotavirus vaccine protects children against that. Because there's some diarrhea, no matter what you do, no matter how hygienic and all that you have, the children can still have rotavirus infection, which is the most common virus causing diarrhea in that age group, 6 to 11 months old, peak period for rotavirus infection, which is why we give rotavirus vaccine. But please take it early. You should be given at 6, 10, and 14 weeks. So you're supposed to protect our children against diarrhea and keep breastfeeding. Don't reduce the breastfeeding because you are now giving complementary feeds. Your baby sitting the breast milk, it protects them against diarrhea. So it's very important that we keep on breastfeeding. These are tips on preventing the diarrhea. But once the diarrhea happens, give ORS, oral zinc until the diarrhea stops, and keep feeding the child. Don't reduce food, because some people that will say, okay, if I don't feed the child, then the stool will stop. Please, no, the child needs more food rather than stopping the food. So it's important that you keep on feeding the child. All right, our time is almost up. I'll run through the rest of the questions. Major Havers, can I give my 1-year-old honey? You can give children honey from age of 1 year, but really, there's really no need to give honey. But please don't give it below 1 year because of the risk of what we call infant botulism. Somebody say, my 20-month-old has bow leg. Can I give vitamin D? You need to see a doctor first. We need to know how severe it is. We need to know what is the cause. Is it what we call physiological? In some family, they tend to have bow leg. It's not really usually bad, but some people is rickets. Some children have other diseases like what we call Blount disease and all that. So we really need to know which level your own child is. We don't just start giving vitamin D. We need to know, is it normal one that there's really nothing to do? Is it rickets? Is it other things? So I would recommend you see a doctor first, then we can advise you on which one. Somebody said, what's the work of cod liver oil? We don't prescribe. So I always don't understand when people ask me what's the work of this. If a doctor has not prescribed anything for you, please don't take it. And if you are taking it, then it's not from us. So we are not sure why you are giving it. So we don't recommend routine giving of cod liver oil to children. Cod liver oil is a source of vitamin what we call the fat soluble vitamins, the vitamin D, E, and all those kind of vitamins. But really, you don't need to give your children all those things, unless there's a reason why a doctor is prescribing them for you. So you don't need to give them routinely. All we want you to give your children is breast milk only. Somebody say, what's the implication of my baby 14-month-old drinking golden more? The maker of golden more says you should not give it to children below 3 years. So I would recommend you follow the instruction of those who make it. So if they say this food is made for children from age of 3, then give it from age of 3. If you want to give they have other brands that you can give to children below the age of 3 years. Why not go for that? So it is. I don't have any answer to give you as to the implication, but I think the manufacturer knows what they are doing for them to say this is the age range for this product. So I think it's just being wise to stick to the maker and whatever they recommend for you. You don't need to buy any food that is packaged. You can have your own food from your own kitchen, cook it, and give your child. You don't need to go for anything made in the stores or anything like that. All that we want your child to eat is your normal food from your own kitchen. All right. So somebody else is quickly asking, can I give my 14-month-old golden month? The answer is no. The manufacturer of golden month says you should give it only from the age of 3 years. They have other cereals for 14-month-old. So go for the one that they made for the 14-month-old. Or you make your own cereal, buy your own mix, make it yourself, make your own pap and give your child. That is all that is there. There's nothing special in it. So I know mother just like it. But you can make your own pap and give your child. It's the same thing. All right. So the next question, I'm coming back to Facebook now, and I'm going to round up with this. Michael, he said, my baby of 3 years is always touching a navel, complaining it's paining her. We went to scan, they said she has umbilical hernia. What can you use for her? So who scanned the child? Who told the child has umbilical hernia? The person should have told you the management of umbilical hernia. Umbilical hernia is not what can I give her. Umbilical hernia is surgery if it is complicated, okay? So see a doctor. And this is a very dangerous trend in Nigeria where people will think this is what is wrong with my child. You go and do tests by yourself, you go and do scan by yourself, and you don't know what to do. Please don't do that. At least for children, I don't have any say about your own health, but please, for children, don't go and test them or do scans or do x-rays without seeing the doctor first. See a doctor first. It is important. If it is money, go to government hospital, see a doctor first. Then we can tell you this is the diagnosis and we can make recommendation. Okay, so you need to understand what is umbilical hernia. You don't know what umbilical hernia look at. Okay, if you go to our Facebook group, we have a group discussion on umbilical hernia. So umbilical hernia, your baby will have a big navel. So the question is, does this baby have a big navel, which you didn't tell us or not? And if your baby is having a big navel and it's really very strong and painful and it's not going down, then that means it's complicated, it's getting obstructed, and that is an emergency surgery. It's not a what can I give? It's a surgical intervention. If it's a mild umbilical hernia that is not paining the child, they can go in, they can come out by itself, soft and all that. We don't do anything about it. We leave it alone because by the time most children are about 5 years old, it closes by itself. So that is why you need to see a doctor. Everything is not what can I give. Sometimes it is operation, sometimes it is leave it alone. So that is why you should avoid doing your own self-diagnosis. All right. Somebody said, my baby was small, I'll be soon after every feed. Okay, I think this is the same person asking the same question on Instagram and Facebook. I've answered that question, so I'll just pass. Somebody said, what is the best time for baby to start rolling over? Baby start rolling by 5 to 6 months. When do they achieve full head control? 3 to 4 months. Why do baby shake in their sleep? There's no reason babies don't shake. Babies are not supposed to be startled. They're not supposed to just so it's okay for them to move, and there's nothing wrong with that. Somebody's asking, my daughter of 2 years had rashes on her body, is reddish. She says itching her. Okay, so 3 days ago. So we need to see this rash. We need to see the rash. So most likely it could be an allergy if it is itching, or it could be an infection as well. So for allergy, there are medications we have anti-allergy medications, but And the most important thing for allergy is to know what is causing it and stop it. So what is she reacting to? A drug? Is she reacting to food? Is she reacting to what? There's so many things that can react to. We need to stop the what she's reacting to and all that. But if it's an infection, then she may need treatment. So post a picture on our Facebook group and we can give you an answer. If you say it's but orange is okay, your baby can take orange, your baby can take apple. What I'm saying is that don't buy the one in the shops. Those are the ones you should walk away, you should run away from. Walking, yeah, I know you're already talking about walking. That's fine. I just want to be cheeky. Someone say good evening. They don't give our baby drugs. In general hospital, they don't give our baby drugs, just the mother. Why do they need to give your baby drugs? Your baby do not need any drugs. It's not just general hospital. In my hospital, in teaching hospital, in all hospitals run by trained, qualified doctors, they know they should not give newborn babies any drug. Your baby do not need any drugs, okay? All this ampiclox, abidec, golva is not good. Do not give your children any drug. Give them only breast milk, okay? Do not give any drugs. This information is evidence-based information. This is information from all pediatricians, World Health Organization. You really don't need any drugs. In countries like UK, where they don't have lots of sunlight, they tend to have vitamin D deficiency. They tend to give vitamin D drops to their own babies because they don't have exposure to sunlight and all that. But all the other people, you don't need to give a baby anything. Definitely not ampiclox. Definitely not cod liver. None of those drugs are necessary. Once your baby is born, take your baby home and breastfeed. That is all that your baby needs. That is all your baby needs. Okay. So please focus on just follow our instruction on what is the best thing to do. This when we give you information, we're not just giving information because this is what we like. We are scientists, so these are evidence-based. So before you make any recommendation, we have done lots of researches. People have done lots of comparison and all that, and we've said, okay, yes, this is the right thing. So it is evidence-based information. Do not give me any drugs, none at all. Just breastfeed your baby. All right, somebody's saying, can I give you a 1-year-old Indomie? Well, with all these issues going on Indomie, I would rather say you should watch. But before, the Nutrition Society of Nigeria said you can give, but you must add veggies. So you don't just give plain Indomie. And of course, you have to be very careful with all those seasonings. Not too much of all those salt, but the most important is that it's not just one Indomie. And some of you want to give a bit Indomie morning, afternoon, night. No, variety of food, including fruits, including vegetables. These are important. So if you have not gone through our guide section on complementary feeding, please do. Somebody say my baby of 4-month chick is that. I think I've answered this question today. We'll just skip that and go to the last question. Somebody, my baby weight is 3.4. She has jaundice. She was treated. 10 weeks baby's weight is 4.2. Is it okay? My breast is not falling already. Well, at 10 weeks, your baby should be weighing more than 4.2 because your baby has gained only about 1 kilo or 1.2 kilo for 10 weeks. That is not good. We expect your baby to be gaining at least 1 kilo per month. So I'm not so happy with the weight of your baby. But then, of course, you've told me why. That's because your breast is not flowing well. So you definitely need to see a pediatrician. It is better to see a pediatrician because most of you assume everything is food. There are many reasons why babies cannot gain weight. It's not all about food. Sometimes a baby has a medical condition, and sometimes the first sign that we will ever know that something is wrong is that baby failing to thrive. So if you take this baby to a pediatrician, there's what we will check. We can ask you to express your breast milk. We will give the child the quantity of milk the child should be taking, and then we will know that even when we're giving all this adequate amount of food, his baby gaining weight, and we will weigh the baby every day. We will weigh the baby every day and check that the baby is supposed to be gaining weight or not. So if the baby is gaining weight when we are giving adequate amount of food, then we know that this is food problem, and then we work on how we can help you to breastfeed your baby properly and all that. But if you are giving all this adequate amount of food and your baby is still not gaining weight, then we know it is not a food problem. We look for other causes of why the child is not gaining weight or failure to thrive, and we will do it. And please, we don't want you to wait until it is too late or it's too, so baby is not gaining weight. That's why you've been going to hospital, you've done 6 weeks, you've done 10 weeks immunization. Somebody should have flagged that your baby is not gaining weight well, and they should have referred to a pediatrician. So I really think you should see a pediatrician for proper evaluation, and that is important. All right. My time is up. I will just answer all the last set of questions in 1 minute. Baby 7 months old can't take formula with solid. I don't think I understand that. What do you mean can't take formula with solid? Can't swallow it without vomiting and diarrhea. Okay, so why is baby not on breast milk? Baby should be on breast milk. Is baby vomiting breast milk as well? That's what I want to know. 11 days is having jaundice. Baby have jaundice. Baby need to be in the hospital. The doctor needs to take the blood, check the level of the jaundice. There's a level of jaundice that don't need treatment. There's a level of jaundice that we need to change the blood. There's a level of jaundice that we just put under phototherapy. So we need to know the level. So you have to take baby to the hospital. They must take the blood. Don't just say jaundice and they're giving ampiclos and glucose water and all those other nonsense some people do. When your baby has jaundice, they have to take the blood. They have to know the level of the jaundice. It is that level that will determine the treatment. Whether you are going to go home and do nothing, or whether your baby is going to go for phototherapy, or whether your baby is going to go for HPT. So, and jaundice is an emergency. It's the brain, okay? We don't want jaundice to damage the baby's brain. There's a level of jaundice that will damage the baby's brain, and baby is going to have lifelong disability. So we are very aggressive when a baby has jaundice. And I'm wondering, is it something just happening at 11 days, or your baby didn't have jaundice before? Because it's very unusual for baby to be having jaundice for the very first time on day 11. So maybe you want to give more information. Baby is lactose intolerant. What do I do? Who made the diagnosis of lactose intolerance? All right. So if a doctor make a diagnosis of lactose intolerance, that doctor know what to do, because they will recommend lactose-free milk. So please do not self-diagnose all these things. A lot of mothers just, my baby is lactose intolerant, my baby is this. Don't do it. Most of you don't. You are not supposed to do that kind of diagnosis. Wait for the doctor to do it. If your baby is able to take breast milk, your baby is not lactose intolerant, because breast milk is lactose, okay? So baby can have cow milk protein allergy. It's different from lactose intolerant. They are two different things. So please don't make those diagnoses. Let a pediatrician do it, and the pediatrician will tell you, if your baby is on breast milk, your baby does not need any other milk. Your baby should continue with breast milk and take the other food. That's all. You don't need formula if your baby is on breastfeeding, even when babies start complementary feed. So there's no need for all that. And if baby can take breast milk, baby doesn't need lactose. Doesn't need any other formula. And that baby is not lactose intolerance. Yeah, so your baby has been having jaundice for over 7 days. So what has been treatment? What is the treatment ongoing? So I really simply don't understand. Yeah, so I believe your baby is already in the hospital for 7 days. So what have they been doing? You need to, if you don't give us all the information, then I will answer only based on what you provided. Can you recommend a good hospital? There are a lot of good hospitals in Lagos. I don't recommend any brand or any. Government hospitals are there. They all have pediatricians where you can go as well. If you want private, Google private hospital, children hospital with pediatricians. Somebody said my baby 2 weeks cry while breastfeeding. Is baby crying and sucking, or baby is not sucking? Because maybe crying doesn't mean anything as long as baby is sucking the breast milk. So you need to clarify that, or you can see your pediatrician or the nurses. Make sure that the most common reason why a baby will be crying while breastfeeding is because you are not attaching your baby to the breast properly. Your baby is sucking on the nipple, and when baby suck on the nipple, no milk flows to the baby, and the baby becomes upset, and baby will cry and bite you and all that. So please make sure your baby is properly attached to the breast, latching of the baby to the breast. attachment of baby to the breast is 98% breastfeeding. If you don't get the attachment, it's going to be frustration for you, for the baby, for everybody. So make sure your baby's mouth is open wide. You push most of the breast into the mouth. You should not see, you should barely see the areola, that black part beyond your nipple. You should barely see it when your baby is sucking. And so when the baby suck, you should feel your breast empty. That is proper attachment. We have videos and all that you can watch so that you know how to. Some of you just quickly put the breast in the mouth, and you most of the time the baby just grab on the nipple. You have to make sure that their mouth is open wide. You can stroke the mouth, and when they open wide, then that is when you put the breast in, and so that they get both the nipple and the areola into the mouth. Okay, and that is the only way baby could be properly attached to breast, and that's the only way baby could suck very well. Baby's weighs 3 kilo, 6 kg at 14 weeks. That's good. I'm rushing because time is gone. My baby was born before her days, so your baby was born pre-time or what? I was given 18 weeks. So all this doesn't really matter. So you need to tell us how many weeks was your pregnancy when you had your baby. When you had your baby, the doctor would have written you are 36 weeks, you are 37 weeks, because the fact that you are given 18 is a 40 weeks date. So if your baby is born at first, you are still born at normal time, so your baby is still term baby, and there's nothing to, you don't need to count anything. You count from the day your baby is born. That is your baby's date of birth. You don't need to say I have to count from the day I was supposed to have delivered the baby. No, it's the day the baby was born. That's the day we work with. All right, thank you so much, everyone. I'm sorry for rushing. Time was gone. All right, so if you still have any questions on any issues about the health of your children, feel free to post it on our Ask the Pediatrician Facebook group Mondays to Saturdays, and we answer them. Every Thursday, I do a teaching on an important topic. Last week we did asthma, we've done malaria updates. So watch out for this week what I'll be talking about, and then you can learn, and feel free to share the video. You can also listen to all my teachings on my podcast, Ask Dr. Gbemi ATP podcast. You can listen to it on many podcast platforms, Spotify, Google Podcasts. You can also go to our website and you can read most of the things I'm talking. If you want to read more details, you can go to our website, www.askthepediatricians.com. You can read and you can learn. But remember, you can always post your question on our Facebook groups Monday to Saturday, and we will try our best to answer them within 72 hours. We do try our best. I know, but if something is urgent, it's an emergency, please don't post on our Facebook group. Go to the hospital straight away. Anything that cannot wait 1 minute must go to the hospital. But anything that is okay, how do I feel? Maybe don't let me. Those ones we can always answer them anytime. So feel free to post this one on our group. Thank you so much, and have a wonderful evening. Bye, everyone. Bye bye.